Yes, American Academy of Pediatrics. Let's go back. The American Academy of Pediatrics says it wants to go back in time. You know what? So do I. I am Dr. K. Paul Stoller. The AAP recently called for America to return to a time when measles was something pediatricians saw only in textbooks. Fair enough. Measles can be serious. It can cause pneumonia, encephalitis, and rarely death. But if we're going to turn back the clock, I say we keep going. Let's go back to a time when autism wasn't being identified in 1 out of every 31 8-year-old children in CDC surveillance communities. Because here's something else the CDC's own numbers show. In 2000, it was approximately 1 in 150. Today, 1 in 31. Now, people can debate how much of that increase reflects better recognition, diagnostic changes, access to services, environmental factors, or something else. But surely every pediatrician in America should be willing to ask one question. What happened? I didn't begin asking that question yesterday. I was a fellow of the American Academy of Pediatrics for approximately 20 years, and in 2008, I resigned. I didn't quietly allow my membership to expire. I published my resignation as an open letter. No les incompetents. My open letter to the American Academy of Pediatrics. That was 18 years ago, long before COVID, long before today's political battles over vaccines, long before questioning public health institutions became fashionable. I believed then that organized pediatrics was becoming too certain about questions that science had not adequately resolved. And 18 years later, I'm still asking questions. Here's one of them. The AAP correctly tells parents that measles can cause encephalitis. Good. Parents should know that. But what happens when a parent reports that a normally developing child experienced fever, seizures, behavioral changes, or loss of previously acquired abilities in temporal proximity to a medical intervention? Do we investigate? Or do we tell the parent what couldn't possibly have happened? Temporal association does not prove causation. Of course it doesn't. But temporal association doesn't prove non-causation either. It gives you something extraordinarily valuable, a question. And questions are where science begins. I have long argued that inflammatory or encephalopathic injury should be investigated as a possible explanation for some cases of neurodevelopmental regression that subsequently receive an autism diagnosis. That's a hypothesis. It isn't proof that vaccines cause autism generally. But here's the point. Why should anybody be afraid to investigate it? If the hypothesis is wrong, good science can demonstrate that. If some susceptible subgroup exists, good science should be capable of finding that too. Either way, the children win. And my relationship with the American Academy of Pediatrics has now taken an extraordinary turn. I went from being an AAP fellow to resigning from the organization to becoming one of the plaintiffs in a federal civil RICO lawsuit against it. Our complaint contains serious allegations concerning representations about vaccine safety and relationships surrounding vaccine policy. Those are allegations. They have not been adjudicated as facts, and the AAP disputes them. That's precisely why evidence matters. I don't want you to take my word for it, and I don't want you to take the AAP's word for it. Look at the evidence. Show us the studies. Show us the controls. Show us the endpoints. Show us the duration of follow-up. Show us which combinations were studied. Show us which neurological outcomes were actively sought. Show us what we know. And have the intellectual courage to tell us what we still don't know. Because science isn't a collection of approved conclusions. Science is a method for discovering when our conclusions are wrong. So yes, American Academy of Pediatrics. Let's go back. Let's go back to a time when children weren't dying from measles. But let's keep going. Let's go back to a time when autism wasn't identified in 1 child out of every 31 in CDC surveillance communities. Let's go back to a time when parents who said, "Something happened to my child," were treated as witnesses worthy of investigation, not problems to be managed. Let's go back to a time when doctors were allowed to ask uncomfortable questions. Let's go back to a time when safe was a scientific conclusion continually tested, not a slogan continually repeated. And most importantly, let's go back to a time when science meant never being afraid of the answer. The American Academy of Pediatrics wants its old world back. So do I. But I want to know what happened to the children along the way. Yes, American Academy of Pediatrics, let's go back. Kenneth P. Stoller, MD, former fellow, American Academy of Pediatrics,